My name is Dr Vamsee Priya. I am a nephrologist at Apollo Hospitals, Hyderguda. Today I am going to discuss with you about dialysis nutrition. Dialysis procedure is generally a painless procedure and it requires about anywhere from 3.5 to 6 hours depending upon the patient's condition and the urine output and his patient's characteristics. Usually it's about a 4-hour procedure, and we advise the patient to eat a small snack 2 hours before dialysis to prevent any kind of low blood sugar episodes or low electrolyte kind of situations that happens on the dialysis. We advise patients to take a glass of milk or a couple of egg white omelette or 1 or 2 idlis, chapati with curry or something like that, or 2 bread pieces. So you should not be empty stomach, and also you don't want to have a full stomach also before going to the dialysis. Always carry a snack with you. So in case if you need it, if your blood sugar goes low, we check the blood sugars during dialysis and give you either the snack or sometimes we give you glucose. The other important thing in dialysis patients is fluid intake and the salt intake. You need to majorly reduce the salt intake, so you do not want to add any additional salt in curd and things like that, or pickles. You need to avoid those habits. Blood sugars may fluctuate during dialysis. So people who are on insulin or people who are diabetic, they may have low or high blood sugars during dialysis. So we advise people to maintain proper meal plan when the patient is on dialysis. So the insulin dosage requirements also may be lower than what it was before, and your protein requirements are usually higher than what it was before. So once the patient is on dialysis, depending upon the time of dialysis and everything, you are required to make certain changes to your diet plan. We advise monthly labs, which tells us about the adequacy of dialysis, your electrolytes, blood glucose levels, your nutrition status, your health status. Based upon all of that, we give a diet plan that is tailor made for you, whether it's a calorie count or blood sugar count or carbohydrate or protein intake. We give you exactly what is required. The other things we need to restrict is phosphorus and potassium. Potassium and phosphorus are removed by the kidneys, and because for the dialysis patients these potassium and phosphorus are not removed, we need to restrict those potassium and phosphorus in the diet. So it's not the same for all dialysis patients, so requirements are generally changed from patient to patient. So in the dialysis unit we have a dietitian, and based on the monthly labs and how the patient is doing, we give you a tailor-made plan. In general, the protein intake needs to be higher in dialysis patients because there is some amount of protein wastage in dialysis patients. So for that, in case of non-vegetarians, you can take chicken, egg whites or fish, things like that. For vegetarians, you can take milk, yogurt, cheese, rajma, chole. There are several options for proteins for vegetarian also, you need not worry. And if in any case you are not meeting your protein requirements, whether you are a vegetarian or a non-vegetarian, we give you a comprehensive diet plan in which we give additional protein supplement, either in form of powder or protein cans we give, so that you are properly nourished according to the requirements.